Appreciate you spending a few minutes thinking about this morning, and I'm actually just going to briefly introduce what we're doing with the insurance, and then Lauren Papari from United Healthcare is actually going to walk you through those packets and the description of your plan that you all have. So as you guys know, last year with Aetna, they were really the carrier that came through for us after you've been with the Blues for so many years. And we were really pretty happy with that plan. Hopefully it worked out pretty well for you guys with having no referrals necessary, which was already an enhancement over what you had before. We're going to be doing that yet again with United. It's a PPO plan. You do not need to pick a doctor, don't need referrals, and it's a very well accepted plan. In fact, United is one of the top 3 largest insurance companies in the country. Every doctor and hospital is familiar with them, and they have a very good reputation for both their customer service and their timeliness in paying doctors, and that they're paying a fair rate to doctors. So why are we making another change? Well, as you can imagine, healthcare reform, which is still in effect, but is now being tweaked. If you guys turn on the news for 5 minutes, you hear about it being talked about. And what has happened is it's basically changing the way insurance companies are rating companies, and individuals. But in particular with companies, in this situation, what we do every year on behalf of Lowry is we meet with Steve and Joe and Brittany, and we kind of say, okay, what are we trying to accomplish? And then we say we want to try to maintain the best possible benefits at the lowest possible cost, to both the company and yourselves. And I don't know if I'm the first person to tell you this, but we have been able to, once again, this will now be our 3rd year in a row, keep the cost to you guys exactly the same, and keep the benefits, in this case, slightly better than last year. So we always love when that's the outcome. When we set out to go find who could possibly be our best partner, and it's really the same kind of work you guys are doing. You guys are out providing a service at a price, and we want to make sure we're providing the proper partner for you that's going to be able to provide a great service at a competitive price, and also be able to provide comprehensive coverage for each of you and your covered family members. So crystal ball, what is happening down in Washington? I actually read all 123 pages, which actually in comparison, the old bill was 2,900 pages, so it's actually not so hard to read the new law. It's called the American Health Care Act. You'll be hearing more and more about it. Most of it won't take effect until 2020, unfortunately, which means there may be some delays on some of the benefits that seem to be talked about. But one of the keys I picked up on is there's 2 parts to the bill. One whole part of the bill just lists all the taxes, and it says this tax is repealed, this tax is repealed, this tax is repealed, this tax is repealed. Last I checked, taxes actually making things go up in cost, so taking away taxes should in fact have a positive impact. So we'll be watching to see how that plays itself out. Again, United has been prepared for either scenario, whether it was going to continue on as is or change, and actually them coming to bat to be your new provider is indicative, I think, of a new environment of potentially more competitiveness, more aggressiveness. We're definitely seeing United be aggressive with a number of our clients, and we're really happy to introduce Lauren to you this morning to walk you guys through your new plan. Thanks.
Well, good morning, everyone. Thanks for taking the time out to go through the benefits. I always feel that these meetings are really, really important. It gets everything off to a really good start to just walk through the plan. Any questions you have, if it's something personal, you can hold until afterwards. I'll stick around if you want to ask me something one-on-one, or if you think it's for the benefit of the group, please ask questions along the way. But United Healthcare, to Kevin's point, is a national carrier. And so one of the real true advantages of always coming to United is that this plan, which is called a Choice Plus plan, so our PPO plan has in and out of network benefits, is a nationally accepted plan. There are no referrals required to see specialists. You'll still have some basic prior authorizations for like an MRI or something, but it's really an open access plan, and you can use it anywhere in the country. So if you're traveling on vacation, it works the same way as if you're standing in Pennsylvania. All you have to do is look up a local, let's say you're in Florida traveling with your family and you're away, look up a local Choice Plus physician, and then you would be able to present your card just as if you're here at home and use the benefits. So hopefully you find it a good switch. We're going to start really with the nitty-gritty, which is the plan summary that is on top of your folder. And then we'll get to more of the lighter stuff, but let's just dive right into the benefits. So These benefit summaries are a little difficult. We're not gonna touch on, of course, every ounce of the 14 pages here, so I'm gonna get you through it pretty quickly and highlight the things that you really need to know and will use most. But your physician copays for this plan are a primary care copay of $20 and a specialist copay of $40. These are in alphabetical order by service, so actually that would be under physicians, under P. And then just to touch on other quick benefits, there is no deductible to this plan, so that's great news. You're gonna have really a traditional copay plan throughout the whole entire benefit summary. So 20 for primary care, 40 for specialists. You will also have a $100 urgent care copay and a $200 emergency room copay. Just to refresh everyone about urgent care versus emergency room, I'm sure you're all familiar now that there are more and more urgent care facilities popping up all around locally here, and probably everywhere you go, you pass one every now and then. But I would say when you can use an urgent care is much more of a savings to you, especially in copayment. It's half the copay, and it's really for anything non-life-threatening. So when you are thinking about, should I go to the emergency room or should I go to urgent care, if you have a pain, sprain, a child that has a high fever in the middle of the night, you don't want to wait to go to the pediatrician in the morning, you want to take them somewhere, urgent care can really resolve all of those things. Emergency room, we think more chest pains, or you really think that you have maybe appendicitis or something like where you have symptoms that definitely, if anything's life-threatening, you would go to an emergency room, or a more extreme case of anything that you can think of internally. So just a little refresher on urgent care facilities. Your hospital copayment is a $300 per day copay, and we're gonna flip to page 6 of this summary. There's a couple benefits we're going to walk through on these next 2 pages. But the inpatient hospital stay is going to be a $300 per day copay up to a 5-day stay. So the first 5 days are your responsibility, up to $1,500, and then covered 100% thereafter. Your lab and x-ray, and then your MRIs, and then we're also going to look at this same type of benefit on outpatient surgery. They have a layered benefit here. So you'll see on page 6, under basic lab. So basic lab would include your blood work that's typically done in a physician's office, or let's say you go to a LabCorp. So LabCorp is going to be our in-network lab. I know you're probably used to using Quest currently. I always find when you make the switch, it's like when you want to buy a car and you want to buy a red car and all of a sudden you see a million red cars. So when you make the switch, there are just as many LabCorp facilities around as there are Quest. So you'll start seeing, you'll just notice them more now that you're in the LabCorp mode. So if you had lab work done, either in a physician's office and they send it out to LabCorp, or if you go to a freestanding LabCorp facility, you're going to be covered 100% for that benefit. So lab work is covered at 100%. If you went to a hospital for those services and had a blood panel done there and actually just went to the hospital only for that lab blood work, then you're going to pay a 20% coinsurance. So it's a little bit less rich benefit because blood work done at a hospital is much, much more expensive to everyone and all parties involved than it is to just go to a freestanding LabCorp facility or have your physician take it and send it out. So we want to drive you towards the lower cost option that's less money out of your pocket. You're going to see the same type of layer benefit on your major diagnostics. So your MRIs, CT scans, particularly with MRIs is probably the most frequent test that's done. Again, if you use a freestanding facility, that's a freestanding MRI facility, it'll be a $300, it's called a per occurrence deductible. You can look at it almost like a copay. So it's just a $300 every time you go for some sort of major diagnostic test. If you went to a hospital for the same test, you're going to see that there's another benefit down here that says $500. So again, we're trying to make you make the right choice where you can, that you can easily go to an MRI facility that's a freestanding one versus go to a hospital for these services. And that's something if your physician recommends that you go to a hospital for some reason, you can ask them, what's another freestanding MRI facility. Also, we're going to talk about a really neat tool that's on myuhc.com called My Healthcare Cost Estimator. And in that tool, you can actually search the most expensive and least expensive facilities in your area that are in network, and it'll show you the pricing on those facilities, and you'll be amazed when you see the difference between going to that hospital or going to a freestanding facility. And then the last benefit that operates exactly the same, that surgery. So the outpatient surgery is actually under S, and it's on page 10. Page 10, you'll see it just in the upper center of the page. Same thing here. Freestanding facility, you're gonna be charged $300, almost, again, per occurrence deductibles, just like the copay, it happens every time. And that'll be for an outpatient surgery that's done in one of the ambulatory surgery centers, something that's a freestanding facility away from a hospital. If you did have to go to a hospital for some reason, let's say a physician just that you're using is just not licensed to perform that surgery at that freestanding facility, it's still covered, it's just going to cost you $500 instead of $300. So again, that involves, having a conversation maybe with a surgeon, if it's a knee surgeon, something that's a small surgery, making sure you explore all your options. And a good place to use that tool as well, that My Healthcare Cost Estimator tool. So they are the major benefits that you would probably most frequently use on this plan. Again, no deductibles to worry about, straight copays pretty much across the board. And back in the very back of the summary, if you look at the last 3 pages, is your prescription. So you kind of start at the back, and it should look like this. So your prescription copay on the plan is going to be a 10, 30, 50 3-tier copay. It'll be the same for specialty drugs. So if anyone has specialty drugs, it's a matching $10, $30, and $50 copay for your specialty drugs, which is unique to the market, I believe. Typically it's a percentage for this higher cost options. The 10, 30, 50, you're gonna see here it says tier 1, tier 2, tier 3. So we have a little bit of information in the packet about our prescription drug plan and how it works. It's a little bit different than other carriers in one way. We always tier the lowest cost option within that therapeutic class in tier 1 for you, so at the lowest copay. So what does that mean? It means that if at any point, most times generics are the cheapest, and you're gonna see most of them in tier 1. But it doesn't follow that all the time. You might see a brand in tier 1 if for that period of time, that brand medication maybe just had a generic launched, and there's a period of time where the pricing flip-flops. And so in that scenario, we're gonna put the brand medication in tier 1 for you, because at that time it might be the lowest cost option. So you might see some things flipped around. I would take a look at the prescription drug list and just kind of see if you have any maintenance drugs that fall into different tiers than what you're used to before. But again, it's not going to follow that generic brand non-formulary tiering that traditional tiering. It's going to be a little mixed up in some cases where the most cost-effective drug is in tier 1, and it might be a brand, or it might even be something that's more expensive than the brand. So just something to take note of. There is a mail order prescription form in your folder. We have mail order pharmacy for any maintenance drugs. It'll be 2.5 times your copay for a 3-month supply. So it saves a half a copay for your 3-month supply rather than picking it up at the drugstore. If you are a new member to us, we do a soft push towards mail order. So something to be aware of is, let's say you have a maintenance drug, it's blood pressure medication, you like picking it up at the pharmacy. It's just what you do. And you go for your couple fills. By your 3rd fill, you have to call Optum, who's our prescription drug vendor, and you have to make a phone call to them and say, I'm going to continue to pick up my prescription at the pharmacy. I'm not going to switch to mail order. If you don't do that before the 3rd fill, when you get there, they're going to make you call before they fill your drug. And again, it's a soft push to try and make you change over to mail order because it is a cost savings to you. And it's just, again, it's not mandatory. The only difference is you're going to pay your full 3 copays at the pharmacy if you choose to continue it at retail. But it is an opt-out. So it's, you have to actively call so that it can fill the 3rd fill. Any questions so far about the medical benefits or the prescription benefits? Okay. So in your packet, there is a bunch of material. The employee enrollment form that's on the left, we have your information. Do you want me to complete it for changes at all?
I suppose,
changes,
right? Brittany, would that be
for
helpful if they have an address change or want to add anybody? Yeah, but
Add
if-
deletes,
yeah.
okay.
Yeah.
So anything
change.
that you're changing, only if you're making a change, would you have to complete this form. Other than that, we have your information as you were enrolled last year, and we're gonna transfer that over to enroll you into the plan so that you don't have to complete that form. And then on the right side, we're gonna walk through just a couple really useful tools. So myuhc.com, this is your welcome guide. It's gonna tell you how to get registered. It's a typical, part of it is just a typical employee portal, right? So you can do all the things that you can do on other portals, like check your claims, look for providers. You can, again, use the healthcare process mirror, which we'll get into, again, as a brief review in a second. But there are a bunch of wellness activities that you can do. It's how engaged you want to be with this site. But this is really your end-all, be-all for all your information. You can also check your prescription drug list. I forgot to mention the prescription drug list will be updated twice per year. So we do update it in January and then again in July on the 1st. So if something's changing, you'll receive like an actual member letter addressed to you that's specific to your drug. They'll let you know that it's changing tiers or if something's no longer covered. But this is a good spot when you register for MyUHC to always check which pharmacies are in network, how your drugs are covered, and then your physician. This is also how you'll access virtual visits. So one of the new benefits that's covered this year under all plans is a virtual visit, and that's gonna be covered at your primary care physician copayment. So you may have seen a couple of our commercials on TV about the Dirty Dancing commercial where she says she comes in too hot and like she falls on her face when she jumps into her husband's arms. So the virtual visits are really big because they're a time saver, they're convenient. If your child has pink eye, something that's simple diagnosis, you know, cough, cold, you need a quick Z-Pak or something, you can log in, but you have to have either FaceTime capability or you have to have a computer with a webcam. So it does have to be a face-to-face interaction. It's not teledoc. So you can't just call and talk to the provider on the phone. You would have to actually use FaceTime. The physicians that you'll be accessing for virtual visits, again, it's gonna cost you $20. It can be done almost any time of night. And they're in-network physicians with us, and actually, if you take the time to like go in and search and choose one, it might be a physician that you can even see in the area. So if you're looking for a new doctor, you might find one that actually does virtual visits as well as in-person visits so that you can see that same doctor all the time either way. So a very convenient ad this year for those visits to be covered. Again, My Healthcare Cost Estimator is a great tool. It's something I highly recommend. It's almost like an Expedia for healthcare. When you go in and search, you're gonna be logged in as yourself, of course, through your benefits. It'll give you a total estimate of what that claim cost is gonna be for your services against your benefit plan. And then if you see green, it's gonna be the least expensive provider or the least expensive facility. If you see a gray number, it's gonna be a market average price. And if you see red, they're the most expensive providers. So when you go on there, it's actually color-coded to help you sort through who are the in-network physicians and how much are they charging and what are those contracted rates and how much is gonna come out of your pocket. Now with you, you have deductibles. You have no deductibles on your plan. So this is gonna be really copay-wise to really research just kind of in your mind where you wanna go and who the most cost-effective provider would be. It's almost for like your own research of who would be that, you know, just to give you a gauge of like pricing and show you kind of why we're making you go to that facility versus that hospital care. But it's a great tool if you need a total cost of care on like a knee surgery and rehab. What's it gonna cost against your benefit plan? It'll bundle everything. The other services that I'll mention are Care24. That's a great service. It's a 24-hour service that includes a nurse line. So again, in the middle of the night, you don't know whether to go to urgent care or make a pediatrician appointment in the morning, or you have an emergency for yourself, you can actually pick up the phone and talk to a live nurse any time of day. Also with Care24 comes an employee assistance program. So you'll get 3 calls into a counselor that's a registered counselor, and you can talk to them about whether it's work stress, whether it's grief or loss or anything that's bothering you, but you have access to a counselor by phone, up to 3 phone calls. And if they think that it's something where you're looking for an in-network mental health provider, they'll actually help you find somebody who's in-network to go see someone in person as well. And then last but not least is Rally Health and Wellness. So Rally is our entire wellness portal. It's as engaged, again, it goes back to, we have tools that I could stand up here and talk about all day long. I mean, we have wellness programs that you can get engaged in. We have online health coaching. We have telephonic health coaching. We have interactive programs that you can chat with someone, over the phone throughout certain months, and they can keep you on track for like weight loss goals or whether it's lowering your blood pressure. But you could also just interact with the site for information. So if you go in and complete your Rally Health survey, it's going to give you a Rally Health age, and it's a whole new gaming feel. It's much more fun. It asks you a bunch of funny questions about like how many glasses of wine or how many beers you have a week, and then it gives you a Rally age. And your Rally age, depending on your health habits, could either be older than you are or younger than you really are as your biological age. So it gives you back this age, and then it says, okay, what do you want to do to improve your health? At this point, then you set missions for yourself. So it might just be, I want to go for a mile run a day. It could be small missions. And then you check in that you did that, and you earn coins. As you earn coins, you can enter sweepstakes to win gift cards, iPads, it could be a bike, and it could be children's, different fitness equipment, children's things. So there's all different raffles that are member-based raffles, and you use your coins to enter the sweepstakes. So it's fun. Once you get engaged with it, I think it's always, it's a good way to like do a little, like a personal trainer online kind of thing if you want to get in shape. The other thing that we are offering now in this size group is Real Appeal. So Real Appeal is a weight loss program that's available to you. If you're interested in Real Appeal, I would suggest that you contact Univest. We can talk to you like one-on-one about what the program fully entails, but basically you work through a group to accomplish weight loss goals, and it's an online virtual experience. We send you a scale. We send you a food scale, so you can actually measure out different types of food, and then if you lose 5 to 10% of your body weight, that's really your goal or whatnot, or you accomplish those goals, then kind of the program's completed. So it's a 16-week program. There's online and virtual meetings with other people that are trying to accomplish the same goal so that you stay motivated. But it's a great program that's no cost to you. And if you want more information about that, we can certainly get it to you. But it's brand new this year. So it's a great, great add onto your plan. That pretty much, I don't know if I missed anything that you can think of.
Yeah, so the virtual visits, you guys remember last year I would talk to you about telemedicine, and what Lauren is saying is that the only slight difference is that instead of a telephone call, it's definitely more of a Skype or FaceTime style. But what's great is you'll see that little brochure in there, and I actually saw one of those commercials last night as well. So there are some nice, clever commercials United is putting out to try to tell people about this. Because one, obviously, it's cheaper for you and much more convenient. And second, I actually have used the benefit personally. My wife is allergic to poison ivy, and she was out weeding, and she touched her face and had an allergic reaction. And I was actually able to have her have a virtual doctor's appointment with a doctor who said, yes, I can see that's an allergic reaction to poison ivy. All we were charged was the primary copay, but she never had to get dressed or leave the house. It was on a Sunday morning. And then he called in a Z-Pack, which I went and filled at a 24-hour CVS for like $6 or $7, whatever it ended up costing. So for your primary copay plus a generic antibiotic, you can get certain things done and not have to schedule an appointment, not have to wait for an appointment, not go to a doctor's office where other sicknesses are happening. That's one of the real takeaways I've been noticing lately is, you could go catch something else when you go get a lot of those things on that list treated by going into a facility of any kind. So it's really a great convenience. The other, any of you who live up the Quakertown direction, there's another new urgent care center being built next to the Wendy's up there, right on 309. You guys have been seeing Patient First, so you guys know that's a brand name of urgent care centers. But pretty much all of the ones that you're seeing popping up, it makes sense for United to contract with them because, again, that's that $100 option versus the $200 or more for ER, depending. LabCorp is who you had when you were with Independence Blue Cross. So you just really have to rewind a year and a half, 2 years ago, and you'll remember that's where you'll be going again instead of Quest. But definitely go there, as Lauren pointed out, because it'll be no cost to you versus that 20% co-insurance. And if you guys are hospitalized or have surgeries or any of those big copays that sound kind of scary, again, one of the things Joe and Stephen and we looked at when we were reviewing the plans is we really wanted to stay away from a deductible plan. And we can tell you firsthand, Lauren and ourselves at Univest, we work with 90 companies. You're one of about 10 who doesn't have a deductible at this point. So that is a very, very generous benefit you guys offer. Almost everybody, including us at Univest, I have a $5,000 deductible before anything's covered. And I work for a 950 employee company. So that gives you an idea. I bet you work for a 300,000 employee company. And she has a deductible. So you get an idea, when you work for these bigger companies, we actually have worse benefits and pay more towards them than any of you. So we just really want you guys to know that this is an extremely rich plan. These plans actually don't really, if they were designing new plans, they would not look like this.
We keep a couple of them, and this is one of the only plans that we have left even in the portfolio that still has copays on everything.
Yeah, so almost every other carrier out there and every other plan that United is offering new to kind of, again, match what the market is doing has gone away from this style of benefit. The other super rich thing about this plan, and it's like on page 2 of this highlight, is a $3,000 limit. Again, that's pre-Affordable Care Act level out of pocket. So your worst case scenario under this plan is $3,000 for any one individual and $6,000 per family. Again, the Affordable Care Act limits are $6,850 for an individual and $13,700 for a family, which is again the kinds of plans we both have. We have plans where I cover my wife and 3 daughters. My out of pocket is like $13,000. Yours is $6,000. As an individual, your out of pocket's $3,000. The average American out there that you're hearing about, it's $6,850. So these are extremely rich benefits, even when some of those copays sound high. In comparison to what's out there, these are actually very, very low. We actually, the prescription copays are lower than they were with Aetna. We just wanted to make sure you guys knew that. Lauren's job wasn't really to tell you what was better than Aetna, but I'll tell you. So those are better than Aetna. I actually really like that tier 1, tier 2, tier 3, because it's not so much about is it generic, is it brand name, anything like that. It's actually, as she said, based on what is the cost of the actual prescription. So you're being charged, proportionately the appropriate copay based on the cost of the prescription, which again is a good situation. Health for Me, is that the name of the
yes. So the app? Yeah, the app's great. So Health for Me will give you access to everything on myumhc.com right through your phone. There's a copy of your ID card on there, so you don't have to worry about where's the little plastic card, especially again if you're traveling. It locates the closest emergency room facility that's in network, so Health for Me is great to have when you're traveling because, again, if you need a doctor, all you're looking up is just where's the closest Choice Plus physician. Also, again, there's emergency services or an urgent care facility that's close by, and it'll give you directions to it as well. You can also schedule calls with customer service if you have a claim issue, where they can actually call you back when it's convenient, rather than you sitting on the phone on hold. Another item that I did forget to go through is preventative care. So preventative care is covered under this plan 100% as you're used to. There's a great brochure in your folder about anything and everything for your entire family from 0 to 3 years of age, all the way up to 65 plus that you would be eligible for, and the right age and frequency. So again, the key to preventative care is how often do you go for that visit that's considered preventative, and then what is the right age to have things done. So if you go, everybody in this room is eligible for one routine adult physical exam every 12 months. So if you went to the doctor at 6 months and try to have another just a physical, they're gonna consider it a sick visit, you'd be responsible for your copay. Still covered, but you're gonna pay that copay for that service in between. Another frequent question that comes up, maybe for spouses, like routine mammogram, same thing. So if it's once every year for any female that's 39 years of age or older, so once every 12 months, if there's something where they have to go back in between at a 6-month mark, still covered, but it's being covered under your diagnostic benefit instead. So it's just a matter of frequency and the right age to have things done to make sure it's covered at 100%.
So on that point, one other slight difference between this plan and the old Aetna plan you had, and before that the old Keystone plan you had, is the Aetna plan you have currently until April 1st and the old Keystone plan were more sort of point of service style plans. the most recent plan, you didn't need referrals. This is a true PPO, which is really more like that old personal choice plan that very few of you had, like, except if you were out of area. So it is a true PPO, and you can go any doctor, no referral necessary. As Lauren mentioned, it's a national network, seamless network. It's not going to matter if it's United in California versus United in Pennsylvania. However, one slight difference is that vision is now not an included benefit, where it was sort of a rider before. So, but we do have rates. Brittany has rates. Brittany and men have rates for a voluntary vision benefit, and we went with the most cost-effective sort of basic vision plan. And we only need, what, one person to sign up?
Right, in
to
order to
offer it?
open the plan, we only need one person to take it, but the voluntary vision plan that you're going to get is a full United Healthcare / Spectera. You might hear the name Spectera underneath because we purchased them years ago. But the benefit that you're looking at is a frequency of every 12 months for an exam, every 12 months for lenses, and every 24 months for frames. So it's a full comprehensive benefit. It's gonna be a $15 copay for your exam, $30 for any materials, and then you have up to a $130 frame allowance. If you went over that, let's say you want the fancy frames, or somebody in your family wants the fancy frames, you're going to get a discount on the overage as well, and that includes anything for additional coatings on your lenses. If you have anti-reflective, things like that, that cost a little bit of money, it's gonna come down a little bit by being a United Healthcare member, if it even goes over the $130 allowance that you have, and then $105 for contact lenses. So it's a reasonably priced plan. I think it's definitely, if you have people in your family that wear glasses, I think it pays for itself, and it's a full comprehensive benefit plan. Again, national network. It will include about 50% private practice physicians, so ophthalmologists and optometrists, and then it will also include 50% retail in network. So your Costco's, your Targets, everything that you think of that's a retail center is also included.
So you can come see Brittany or Amanda for the price, but I'm just going to read them to you. For the month, if it's just you, it's $5.78 a month. So as you're hearing, you'll more than get that money's worth back when you go to use it, and that's before taxes would come out of your pay. So it would be a pre-tax benefit, so it wouldn't even cost the full $5. For an employee and spouse, it's $10.98 or $11 a month. Employee and child or children, $12.83. And employee and family, so no matter how many kids, $18.09. And again, you know, I have a family where I don't wear anything, but my wife and 3 daughters all wear something. I would definitely pay that $18 because we more than get our money's worth by getting the exam and the allowance towards glasses or frames. So we think at least one of you are going to want this. So we're going to make that available, and they've got the information up here both about the benefit and the price. To do it, can they elect it on the form? Is that what you would recommend?
They can if they, yep, you can use the forms for that.
Okay.
There's a place for vision.
All right, so maybe the only other reason you would use that form that's in your packets is either if you're making any changes, because this is open enrollment, so this is that one time a year you can add or drop a dependent for any reason.
And up at the top of this third page, like the section on the inside, it says whether you're taking medical, which if you're already enrolled, you can leave it, you know, unless you're making any changes, but then you can elect if you want the vision plan right there.
Yeah, so that's probably going to be the best way, because we would want to see some kind of an election form from you in order to verify that you want it. And again, you can't just elect it for a month, use it, and drop it. It is a year enrollment, so it would be in April to April. But this would be a way for any of you who have been using other vision benefits that have been sort of just included with the plan in the past to do it. And again, here it's just being done on an optional basis, which is really what most of our clients do at this point. Because we have moved away from more of those point of service style plans where it's a rider to more of these sort of standalone vision plans, which is what we're doing here. So we just don't want you to forget about that or think that that's included, so we didn't want to not mention that that's also an option for you. But at this point, we've done pretty good on timing. So if you guys have any group questions, because if you have a question, probably some people are thinking of the same thing, we'll be happy to help you.
Sure. So if you're already currently enrolled in our plan,
Yes.
and you have no changes, do you have to fill this out at all? Or
Unless you want the vision, so yes.
just wouldn't have to do anything? Right?
Correct. If you have the current plan and you don't feel you need the vision rider, you don't need to do anything, you will get everything we just talked about except vision.
Also, make sure if you're enrolling in a different type of coverage, so let's say you're a family for medical, but you're just taking vision yourself, just make sure that that's clear on the enrollment form, that it's a different, vision enrollment only. Like, make sure if you are somebody who's gonna enroll differently from one coverage to the other.
And to your question, back to what I said at the beginning, it's the same cost as it was last year. So if you make no change and you don't add vision, it will be the exact same payroll deduction as all of last year for these new benefits you just heard about. So hopefully that all sounds good. Yeah.
All right. So do you have to wait until after April 1st, and that's when the new coverage begins, to create a profile for this?
You
thing?
do,
You're
yes.
gonna need your, member ID and,
So after
to
we
log
get our card,
into.
you can do that.
Yeah,
Correct.
actually even before that potentially, but yeah, if you want to wait to get your card, that probably would be best. So what's happening is we'll be doing an enrollment spreadsheet, so to speak, where we're taking all the information from Aetna, sending it to United, and then Lauren will sort of confirm back to us your group number and all of your individual ID numbers, which is of course what then generates your ID cards. I imagine that's not going to take much longer than a couple weeks.
right, so what I'm gonna do in the meantime, just in case the cards aren't actually physically in hand, I always create a temporary ID card file for all of you, which has an actual picture of your card. And you'll be able to take this piece of paper with you instead of logging in and printing a temp ID card, just in case, if timing ends up that, people are still dragging a little bit, getting their forms in. I just want everybody to have the actual information with the VIN number for the prescription, everything that a doctor would need will be on that paper file that I'm gonna give you.
Right.
So no matter what, once we get a policy number, the next day I can generate that file. So you will have a card in hand for one, I would anticipate.
Yeah, and
a
then,
paper card.
and then even with that, you can then go on and register on the
Yes.
MyUHC. So
Yeah,
once
we have
that's been
everything.
generated, you're good to go. You don't actually need even the physical card. But yeah, I highly recommend all of you guys put that app on your phone. I know for our carrier, I have that carrier app, and pretty much everything I need is right there. My ID card's on it, my copays are on it, so all this stuff, you don't have to remember it. It'll all be there. You'll actually just be able to pull it up. Things like mail order prescription information would be on there, finding those urgent care centers that participate. So there's a lot of reasons, especially these days as we're all kind of traveling around and have our phones on us, that is a very good tool to make sure you guys are using, and your covered dependents. I mean, I've now talked to my wife about using that benefit as well, as opposed to always calling me to ask what our copays are. So that's not a bad idea as well. Any other questions about the plan? Yeah?
If you're gonna opt to take the vision, do you have to fill the whole format or just section D?
It would just be, again, just to be clear, if we already have all of your other information and you're matching exactly what medical is, then you would not. I mean, if that's okay with you, if that works for you,
Yeah.
and just make sure that it's just for the vision. And again, if you were adding dependents to that or any, we would need their information to enroll, so only if it's different.
Yeah, I think that's a great question for all of you. If that's all you're doing, just put your name and go to that section and tell Brittany you want vision. That'll make it easier for Brittany to understand what it is you're doing.
Yeah.
Otherwise,
We actually pass like a paper around in the meeting and they can write their name down and then we can just add it to the spreadsheet.
Yes.
that's
It's up
also
to you
fine.
how you
Cause then we
wanna
have
collect the
everybody
info.
in here and like,
I'm fine with
we
that.
could do
Yeah,
that.
I mean,
Or you just want to say, do you want vision, to raise your hand and we'll just write
Yeah,
it
that's
down?
true, we could do that too.
We'll figure out a
Have a
way.
sign-up sheet,
Yeah.
I mean, yeah.
Can leave it with us when we leave and just check off the vision if you want employee only.
Yeah, it's possible we won't even have you do those forms. We'll figure something out. But
But yeah, like I said.
that is sort of the only really decision you need to make, basically,
Otherwise, we can-
relative to this. And again, if you're wanting to make sure your doctors participate, that type of thing, uhc.com.
It's welcome to
Oh.
uhc.com.
Welcome to
So welcome to uhc.com, you can look up as a free member all your prescriptions, you can search pharmacies, you can search any other information really that you're looking for without having access to my UHC yet.
Yeah, in case somebody says, like, I know if we change insurance, my wife wants to know, does my endocrinologist participate, this type of thing. Though, at the very least, you guys may want to do that. Again, as I mentioned earlier, they're a national carrier. This particular area, which is where most of you are, they're very, very accepted. There's very few areas. If any of you are up in the Poconos, we were talking about this earlier, I don't think any of you are. There's just the Geisinger system is not in it, but St. Luke's and Lehigh Valley are, and that generally would cover any holes there. But beyond that, yeah, if you guys, both either traveling or any of the geographies, any of the Lowry employees and their dependents live in, and or if you have out-of-area college students, I always kind of forget about that, but this is an even better plan for that, because no matter where they are in the country, United is gonna have a presence. And because you don't have to pick a doctor, they just basically just show up with their United card and they can use the benefit. So if that applies to any of you guys. Any other questions? No?
That's good. Thank you very much.
Right, thanks.